On today's video, I want to talk about ICD codes, and in particular, why they're a little bit more important than you might think, and how they're supporting a lot more than just administrative actions and billing-related activities. So ICD codes, if you're not familiar, are a structured way to represent patient conditions, and they allow systems to reason, trigger logic, and guide care, which matters because IT systems do not think the way clinicians do. Clinicians interpret patient information based on experience, context, and patterns that they see over time. Systems don't work that way. They rely on structure. And ICD codes are one of the main ways that clinical thinking gets translated into something systems can actually respond to. Once a diagnosis or condition is active and in the system, whether it's confirmed or still being considered, the system can start using that information to shape its behavior. It influences what shows up, what stays hidden, and what the system is going to pay attention to. At that point, the system has enough structured information to start being helpful to users. That might mean certain order sets appear, care pathways become available, and documentation prompts now match the patient's situation. Alerting can also change. New alerts might fire because a condition is present, and other alerts might be suppressed because a diagnosis changes the clinical context. So what matters here when we're talking about ICD codes is not that the diagnosis is perfect, it's that the system has enough information and that information is structured so it can use it. This is also why timing matters. If a working diagnosis isn't reflected in the coded data, the system won't be able to support the clinician fully in real time. It can only react to that diagnosis later when it might not be as helpful. For example, if a working diagnosis of TIA is added to the patient's record shortly after they arrive in the emergency department, that may place them on a stroke dashboard and send a notification to the stroke nurse. Care coordination workflows can then start to work in parallel with clinical assessments. But if that doesn't get added until later in their stay, the risk of something being missed may increase. Health IT systems don't reason the same way people do. They don't infer, they don't assume, and they don't read between the lines. They respond to what is explicitly represented in a structured form. After all, it's a computer. Without a structured translation, even very sophisticated systems react as if they're unaware of what's going on with the patient. That becomes very evident when you're looking at things like registries and reporting. If a patient diagnosis isn't added to the record, that particular patient might not even show up on a report or dashboard. And if the condition is outdated, then the computer might continue to rely on an assumption that isn't true. When that happens, we often think of it as a system failure, but in reality, it's just a data representation problem. Functionality that's tied to structured, coded information is also where people start to talk about system intelligence. Not because the system is suddenly becoming smart, but because patterns can start to emerge when data is represented in a structured way and it's used consistently over time. Health IT systems aren't intelligent on their own. They need consistent, reliable, structured information to work with, and ICD codes play a huge role. They feed clinical decision support rules, analytics, quality measures, and risk models. Over time, systems can use these ICD codes to identify trends, highlight patients that need closer attention, and support more automated, proactive workflows. The intelligence isn't coming from the system thinking independently. It's coming from how consistently conditions are represented and maintained. If your ICD coding is incomplete, outdated, or delayed, that intelligence layer is going to weaken. Dashboards start to feel unreliable, alerts feel noisy or irrelevant, and user trust in the system begins to erode. Maintaining accurate ICD coding on a patient isn't the responsibility of a single role. Clinicians understand the patient and the clinical context, but analysts are going to build the logic that responds to the coded data, and informaticists are going to sit in the middle, making sure the workflows support timely entry and appropriate automation. When those pieces align, the system starts to feel supportive instead of frustrating. So next time someone mentions ICD codes, you know that they're not just some administrative task sitting in the background. They're actually part of the logic that helps interpret what's happening with a patient so the system can respond appropriately. Hopefully understanding that role will help you see coding more like an input to safer, more coordinated care, instead of just something that you need to do to meet a regulatory requirement or to support billing activities. I'll see you again next time.